maybe six grocery stores in an area of what, 15, 20, 30 square miles?
Yeah.
Is that enough?
No, that's not enough. And one of the things, when it comes to grocery stores, one of the things People's Grocery focuses on really, really specifically is that you can always eat healthier, right? So there's Mandela Foods Cooperative, which people tend to talk about when it comes to healthy food options in West Oakland. But more importantly, right down the way from Mandela Foods Cooperative is the 99-cent store. And we've taken it upon ourselves to really help people understand how you can always eat healthier no matter where you are. There's the Chef Boyardee, easy, right there, heat it up, you can eat it. Or you can get noodles and tomato sauce. Now, when it comes to what you can buy at the 99-cent store, there isn't that much difference, but when it comes to the amount of salt and many, many other things between the ingredients of those two things, that's actually healthier, is just getting noodles and tomato sauce. And getting some shrink-wrapped bell peppers at the 99-cent store to put in the tomato sauce, there's always ways to eat healthier. And so that's what we try to focus on, because there's an eating healthier here where most people actually can do, even if all they have access to is liquor stores. And then there's the healthy that the mainstream talks about when it comes to organic foods and non-GMO foods. That tends to be, we need to go a little further, especially in communities of color and low-income communities, to really talk about this in depth. But this conversation is what's much more relevant, not just for people of color even, for the majority of the country that eats at Arby's, that lives in the, the land of the strip malls, talking about eating healthier at regular, not just grocery stores, but regular corner markets is usually the way to go.
And
GMO is genetically modified organisms. So GMO foods are the foods that have artificial DNA injected in them to make them better crops. And we eat them every day in America because they're not required to be labeled here.
I just actually wanted to add a little bit to what you were talking about in terms of the answer to the question about 4 luckies or any other number. I definitely want to impress upon the journalists in the room, and I'm not one, how important it is to use your power and your positions to really reframe some of these discussions, because the question of how many, as if there's a magic number that's enough, I think puts this out there in the wrong way, particularly for the African American community and communities of color and low-income communities throughout the country. There are tremendous disparities, as the data shows, and the solution to those disparities is extremely complex, as I think your panelists are telling us. But I think what is missing is this discussion about taking it away from just talking about an individual's behavior and really talking about the policies and the decisions that are beyond an individual's control that have created the environments that we're in. So yes, there may be a lucky, but to get to the lucky, you pass, as she's indicated, a whole bunch of other stuff in your environment, and you don't have a car, and you don't have a way to, even if you're on public transportation, carry the food in bulk, hold your kid's hand, get to work, get back, all those things that you guys have described. And like you said, that you're also living with asthma, with the stress of not having a good job, with all the things that are in our environment, because it is all cumulative. And so I guess the point I really want to stress is there's absolutely a role for individual behavior, but that's all we ever hear about is you should do better. You should eat better, you should breathe better, you should figure it out how to exercise at the right time of day. But I think what we need is also for the journalists in the room to be able to stress to the policymakers, the decision makers, the corporations, that they need to do better, a whole lot better, and that the consequences are what people are dying for, and shouldn't have to, and don't have to. And our tax dollars are supporting circumstances that set us up. So yes, our houses could be cleaner, but so could the freeways be placed away from homes and schools and the places that we have to walk. And the impact of that would be tremendous. So, but the last little thing I want to do is a commercial, because I'm worried that not everybody will stay. I'm speaking later on the panel. But I bought all these executive summaries of a report that has recently been written with the support of the California Endowment from the organization that I'm from, PolicyLink, and it's called Why Place and Race Matter, and it talks about a lot of these issues, and it gives examples of case studies. So if any of you are leaving, please get a report. And for you, Nikki, here's a picture of Kennehawn Park to show the oil wells in the background of where the kids have to play. I'm from LA. So there's many of these, more than enough to go around, so please make sure that you take one.
Yeah, I'd like to respond to that. Anybody who's worked for any of these, for news organizations, radio, television organizations. I work for Channel 2, I work for Channel 4, they don't want you to do that. They don't even want you to have a curriculum of diseases and things that people have. They want you to comment on something that somebody reported from Uzbekistan about some very strange health issue or something that was just released in the newspaper that's not really even science. And then once at CBS, I sat down with them to give them a curriculum. So let's do some things about hypertension and diabetes, and these are the things that people have. It was like a blank stare, and they don't really want to do that because it's not the kind of exciting thing. That's one of the reasons that we kind of got our own thing, so that we can talk about the things that PolicyLink does or that you're doing, or give life to others. But there's not enough people and there's not enough resources. But I think your point is very well taken, because otherwise it's not going to change. I mean, if you can just look at how people talk about unemployment in the African American community, they'd have you thinking that 70% of us want. If in one time I did a survey and asked other African Americans, what was the unemployment rate among African Americans? I got anywhere from 40 to 60%, because that's what that's the image that they paint. But I do think you're absolutely right, but I don't know how that changes. It probably changes because we have opportunities in new media and the opportunities for you to do and expose things differently. But in traditional media, which is where most people get their information, I don't know, and Bob's been at it longer than I have, I don't know how you change that.
Can I ask something real quick? Have everybody seen the story, the new PBS program with the professor from Harvard and about Cuba, blacks in the Caribbean? And one part of the story is that in Cuba at one time, to overcome illiteracy, they did this mass campaign of going to the countryside. And I think we have to have eventually mass entries into our communities to educate people, to have the triage tents and whatever else to come every 90 days, every whatever days to our communities, to African American communities, to make people be aware. We don't have that such mass. We have mass media, but we don't have mass access places where we actually gather with people very periodically to educate them, to give them lots of information, to show that there are these systems out there that they can overcome these things. I think that's part of needs from the mass media. How does the mass media help us organize those type of things ongoingly? They just did such a thing out at the Coliseum, but I just think that based on resources, lack of resources, we have to have these voluntary, ongoing mass exodus into community with the mass messages of how you take care of yourself. If you plan on being here long and the prevailing information on mortality. I just think that those type of things need to be ongoing and organized within our community.
And actually, the last tag on that, we're doing something just like that with our programming at People's Grocery, because we noticed when we went to the community to try to pull out solutions for chronic community health issues related to food, they were all behavioral in nature, because that's just the most easy thing to understand. People's projects that they wanted to do in the community were getting other people to change the way that they ate based on education. And so we've been going through a process of taking a small group of people who want to change community health and do massive projects in the community, shifting from individual behavior to this is the system that has caused this, and going through a series of workshops to see how that concept and how that kind of context can infiltrate someone's individual behavior change projects and then trickle down to the way that they approach community health. So then I think it would be the journalist's job, and what we're trying to set up is a way for these then 6 to 10 community leaders to go into the public and be able to talk in very simple and in their own words terms about the difference between individual behavior change and systemic change, and how they went through this journey themselves and are now approaching community food and health from that perspective.
As a journalist, and I think that's what you want to hear from a little bit, one of the things that makes a story kind of come to life for us, if you will, is what we call the first-person narrative, i.e. you have an issue, that you kind of want to bring to the fore, but you always bring us experts. Love experts, but not good storytellers. And I'm going to tell you that because the better storytellers are the people who are being impacted and who have to deal with the issues. Couple of things as it relates to two of the panels, the two in the middle. One, I work on the East Coast, so I bring a different kind of perspective to these discussions sometimes, especially here on the West Coast. We had an issue with cockroaches causing asthma, and Johns Hopkins University did an actual study on that. So I know dust is a big issue out here, but also it was some of the other excrements from other things that went on. But if I were going to do a story about that, I would want to have a first-person narrative and not necessarily someone who looks like us. So I would suggest that you try and find that. As it relates to the woman who was talking about grocery stores and so forth, I think the biggest issue that we have, and I think you hit on it with the Chef Boyardee example, we do like things fast, quick, in a hurry. And I've noticed that there are very few people who actually do cooking. Now, one of the things that I'm always looking for are things that are a little off the beaten path. Not the gal who's trying to do the Food Network thing, or the kid who's trying to do the Food Network thing, but someone who's trying to pass along that tradition. I'm hoping that either of you can kind of address those issues.
So, Mike first.
You see
First
that?
person with narrative.
You see, that's the classic. No, I agree with that in terms of technique. But that's the classic example. You know, the biggest allergen in black communities is house dust. But when it became cockroaches, it became more interesting because all of a sudden they had something to focus on other than the people. I mean, house dust has always been the biggest issue in the African American community. But the cockroach gets a tremendous amount of publicity, not because it affects, because it's a cockroach. And so that's one of the things that in allergy we've always been concerned about. These are the kinds of things that get promoted. I mean, I'm not saying that it's not important, but just regular dust without cockroaches, whatever it is, couldn't get any traction. But I do think you're absolutely right about the techniques. I mean, you have to get people involved, and we only have a minute for some of our segments, so we try to use 10 seconds of a voice or somebody saying something. But here again, the problem here on the West Coast is just getting exposure for any stories, so we can do it any kind of way.
Yeah, and I would also say that that's why the program that I just described, People's Grocery, that's why we ended up going that route, with finding people in the community who wanted to do projects to improve community health, who were the most affected by them. And then when we got their stories, their projects were mostly individual behavior change. But through a process of workshops with us, they're coming to see what the systemic issues are behind the issues that they identified to create a project that's more holistic. And I think that that would be a very compelling story, is to talk to someone who's most affected by the issues in a community who, through a process of dialogue and conversation, got to see how their individual behavior change solution actually shifted into a systemic change solution.
Oh, you can't do it. I want to see the change. I want to see the problem. Let's solve the problem.
Yeah.
Excuse me, we have a panel up here. Excuse me, we have a panel up here.
I'm sorry.
We have a panel up here. And my question is to the media, how did that policy or practice come about that you have to have the way you put it? Where did that come from? Why do you have to have this personal story instead of looking at this community problem? I want to understand where is that, is that a practice or a policy, and we need to attack that. Because when you put it, because we just got to say, we in the African American community, especially in the low income community, always being as the you must. You are the cause. And it don't seem to be related back collaboratively, how did we get there? Collaboratively, let me atone to my responsibility. Like she just got to talk back about McDonald's. So we have these practices and policies that come to us as though that's the universe that we all operate out in.
Right.
And that's the university, that's how we all have to do what we have to do. And myself personally, I'm always challenging the policy of the practice when it does not give me as a black woman and in the black community a choice.
And actually,
And I think that's kind of disingenuous where you're not hearing from my experience and try to support me in my leadership in my remit. But I have to toe the line for somebody else's thinking someplace else, and not really trying to get down to what is the root causes of my issue.
And actually,
And why have to be in very place of salacialism or being a celebrity or something like that to be able for my root causes to be taken care of.
Indeed. And the way that we've dealt with that really is that I think when I first got there, at least, I didn't have any faith at all in the media to actually tell the story we needed to tell, because the media tends to focus on the problem. And so we create our own media, and we try to get that out there, and then the stations that can pick it up do. But I understand that journalists are constrained, and within the larger news system, and the cycles do feed off of problems and feed off of despair a lot of times. So I don't know what to do about that. I will place that in your hands, but the solution that I have come up with is my work is going to focus on the solutions. I, as an expert, can talk about my personal, oh, my great aunt has her feet amputated, and if you want to put that on the air, then you can. But I know that in my day-to-day work, I'm going to be working with the community on solutions. And then I think to address the Chef Boyardee question, so we do talk about individual behavior change when it comes to you can eat healthier over here, even if you're eating Chef Boyardee and you don't have access to much else. But what's underlying in terms of the structures is society, decades ago, used to value children being able to cook, which was why home economics was a part of schooling, so that no matter what household you came from, the school system was taking it upon themselves to actually educate you on how to function in society. Imagine that. Here's how you clean. Here's how you cook. So that when you go out there, all you know how to do is not algebra, which you will probably never do again. And so when we've seen education become more and more abstract, that means the communities of privilege who can afford to be home and teach their children how to cook are now the only ones that do. And all we tend to hear about in mainstream media is, okay, well, no matter how much money you make, you need to value healthy foods and make the time to cook. But the conversation is not what the heck happened to home economics so that it equalized the playing field amongst people who may not have had the time.